Welcome back to MCQs Master 101. Today, we're tackling 50 mental health Nclex questions, Nclex practice questions, and these are not your basic textbook recall questions. Psychiatric nursing on the Nclex tests therapeutic communication precision, safety and priority decision-making, crisis intervention, defense mechanisms, medication management, legal and ethical judgment, and the exam loves to test subtle wording traps. In this session, you'll face high-level clinical scenarios designed to challenge your thinking the way the real Nclex does. After each question, we'll break it down clearly so you understand why the correct answer is right and why the others are wrong. If you're serious about passing the Nclex on your first attempt, stay focused, think critically, and answer along before I reveal the solution. Let's begin.
Question 1. A client with major depressive disorder states, "I feel empty and tired all the time." Which response by the nurse is most therapeutic? A. You should try to stay positive. B. Everyone feels like that sometimes. C. Tell me more about what feeling empty is like for you. D. You need to focus on things you enjoy. Answer C. Tell me more about what feeling empty is like for you. Rationale. Open-ended responses encourage expression and therapeutic communication. Question 2. A client with schizophrenia is experiencing auditory hallucinations. Which nursing action is priority? A. Agree with the hallucinations. B. Distract the client immediately. C. Assess the content of the hallucinations. D. Tell the client the voices are not real. Answer C. Assess the content of the hallucinations. Rationale. Determining if hallucinations command harm is essential for safety. Question 3. A manic client begins spending excessive money and refusing sleep. Which intervention is most appropriate? A. Encourage group therapy. B. Provide high-calorie finger foods. C. Offer choices whenever possible. D. Teach relaxation techniques. Answer B. Provide high-calorie finger foods. Rationale. Manic clients burn calories rapidly and often cannot sit for meals. Question 4. A client with panic disorder reports chest pain and dizziness. Which nursing action is first? A. Teach deep breathing. B. Leave the client alone. C. Administer PRN anxiolytic. D. Assess airway and breathing. Answer D. Assess airway and breathing. Rationale. Physiological stability is always the first priority. Question 5. A client states, "I wish I would just not wake up." What is the nurse's best response? A. You should talk to your family. B. Why would you feel that way? C. Are you thinking about harming yourself? D. That sounds like depression talking. Answer C. Are you thinking about harming yourself? Rationale. Direct assessment of suicide risk is critical and does not increase risk.
Question 6. A client with obsessive-compulsive disorder repeatedly washes hands. Which nursing response is best? A. Stop the behavior immediately. B. Allow unlimited hand washing. C. Set time limits on rituals. D. Punish the behavior. Answer C. Set time limits on rituals. Rationale. Gradual limitation reduces anxiety without escalating distress. Question 7. A client taking lithium reports nausea and diarrhea. What is the priority nursing action? A. Give anti-diarrheal medication. B. Hold lithium and notify provider. C. Encourage increased fluid intake. D. Reassure this is expected. Answer B. Hold lithium and notify provider. Rationale. GI symptoms may indicate lithium toxicity. Question 8.
A client with PTSD becomes startled by loud noises. Which intervention is most helpful? A. Exposure therapy immediately. B. Maintain a calm environment. C. Encourage confrontation of trauma. D. Limit family visits. Answer. B. Maintain a calm environment. Rationale. Reducing triggers decreases hyperarousal. Question 9. A client with anorexia nervosa refuses to eat meals. Which nursing action is most appropriate? A. Allow food choices. B. Force feed the client. C. Supervise meals closely. D. Cancel meals. Answer. C. Supervise meals closely. Rationale. Supervision prevents food avoidance behaviors. Question 10. A client with alcohol withdrawal develops tremors and confusion. What medication is expected? A. Haloperidol. B. Naloxone. C. Diazepam. D. Disulfiram. Answer. C. Diazepam. Rationale. Benzodiazepines prevent seizures and delirium tremens. Question 11. A client diagnosed with borderline personality disorder exhibits splitting behavior. Which nursing approach is best? A. Set consistent limits. B. Provide frequent reassurance. C. Assign multiple nurses. D. Ignore the behavior. Answer. A. Set consistent limits. Rationale. Consistency reduces manipulation and staff conflict. Question 12. A client on clozapine reports sore throat and fever. What is the nurse's priority? A. Give acetaminophen. B. Document findings. C. Obtain a CBC. D. Encourage fluids. Answer. C. Obtain a CBC. Rationale. Clozapine can cause agranulocytosis. Question 13. A client with dementia becomes agitated in the evening. This is known as A. Delirium. B. Sundowning. C. Psychosis. D. Depression. Answer. B. Sundowning. Rationale. Evening confusion is characteristic of sundowning. Question 14. A client states, "The TV is sending me messages." This is an example of A. Hallucination. B. Illusion. C. Delusion. D. Flight of ideas. Answer. C. Delusion. Rationale. Fixed false beliefs indicate delusions. Question 15. A nurse caring for a suicidal client should place the client in which room? A. Near the exit. B. With a roommate. C. Close to the nurse's station. D. At the end of the hall. Answer. C. Close to the nurse's station. Rationale. Close observation improves safety. Question 16. A client experiencing grief states, "I feel numb." This represents which stage? A. Anger. B. Bargaining. C. Denial. D. Acceptance. Answer. C. Denial. Emotional numbness is common in denial. Question 17. A client with anxiety is hyperventilating. Which action is most effective? A. Encourage slow breathing. B. Provide oxygen. C. Leave client alone. D. Give caffeine. Answer. A. Encourage slow breathing. Slowing respirations reduces respiratory alkalosis. Question 18. A client on MAOIs should avoid which food? A. Apples. B. Yogurt. C. Aged cheese. D. Rice. Answer. C. Aged cheese. Rationale. Tyramine can cause hypertensive crisis. Question 19.
A client with delirium differs from dementia in that delirium is A. progressive, B. irreversible, C. acute and fluctuating, D. age-related. Answer C. acute and fluctuating. Rationale: delirium has sudden onset and variable course. Question 20. A nurse uses silence during an interview. This is an example of A. giving advice, B. therapeutic communication, C. non-compliance, D. avoidance. Answer B. therapeutic communication. Rationale: silence encourages reflection and sharing. Question 21. A client with bipolar disorder is taking valproic acid. Which lab value requires immediate attention? A. platelets 90,000 per millimeter cubed, B. sodium 138 milliequivalents per liter, C. hemoglobin 13 grams per deciliter, D. calcium 9.2 milligrams per deciliter. Answer A. platelets 90,000 per millimeter cubed. Valproic acid can cause thrombocytopenia, increasing bleeding risk. Question 22. A client suddenly becomes confused, disoriented, and agitated after surgery. Which condition is most likely? A. dementia, B. depression, C. delirium, D. schizophrenia. Answer C. delirium. Rationale: acute onset confusion after surgery is characteristic of delirium. Question 23. A client with schizophrenia displays flat affect. This symptom is classified as A. positive symptom, B. negative symptom, C. cognitive symptom, D. somatic symptom. Answer B. negative symptom. Rationale: flat affect reflects diminished emotional expression. Question 24. A nurse is caring for a client with antisocial personality disorder. Which behavior is expected? A. excessive fear of abandonment, B. lack of remorse, C. emotional instability, D. social withdrawal. Answer B. lack of remorse. Rationale: antisocial personality disorder involves disregard for others' rights. Question 25. A client taking SSRIs should be monitored closely for which adverse effect during early treatment? A. bradycardia, B. increased suicidal ideation, C. weight gain, D. hypertension. Answer B. increased suicidal ideation. Rationale: energy improves before mood, increasing suicide risk early in treatment. Question 26. A client states, "If I don't wash my hands, my family will die." This is an example of A. compulsion, B. obsession, C. delusion, D. hallucination. Answer B. obsession. Rationale: obsessions are intrusive, recurrent thoughts causing anxiety. Question 27. A client experiencing alcohol withdrawal has a BP of 180/100 millimeters mercury and hallucinations. Which condition is suspected? A. alcohol intoxication, B. Wernicke's encephalopathy, C. delirium tremens, D. Korsakoff syndrome. Answer C. delirium tremens. Rationale: severe autonomic instability and hallucinations indicate DTs. Question 28. A nurse should use which approach when communicating with a paranoid client? A. whispering, B. humor, C. clear, simple statements, D. challenging delusions. Answer C. clear, simple statements. Rationale: direct communication reduces misinterpretation and suspicion. Question 29. A client on haloperidol develops muscle rigidity, fever, and altered mental status. What is the priority action? A. give diphenhydramine, B. administer benzodiazepine, C. stop medication and notify provider, D. encourage fluids. Answer C. stop medication and notify provider. Rationale. Symptoms indicate neuroleptic malignant syndrome. Question 30. A client with depression is prescribed ECT. Which statement indicates understanding? A. I will be awake during the procedure. B. Memory loss may occur temporarily. C. ECT is used only as punishment. D. There is no anesthesia used. Answer. B. Memory loss may occur temporarily. Rationale. Short-term memory loss is a known side effect of ECT. Question 31. A client with dementia repeatedly asks the same question. What is the best nursing response? A. Ignore the client. B. Reorient repeatedly with frustration. C. Answer calmly each time. D. Tell the client to stop. Answer. C. Answer calmly each time. Rationale. Reassurance reduces anxiety in dementia patients. Question 32. A client expresses anger towards the nurse instead of the provider. This defense mechanism is A. Projection. B. Displacement. C. Regression. D. Rationalization. Answer. B. Displacement. Rationale. Emotions are redirected to a safer target. Question 33. A client experiencing mania speaks rapidly and jumps from topic to topic. This is known as A. Circumstantiality. B. Echolalia. C. Flight of ideas. D. Neologism. Answer. C. Flight of ideas. Rationale. Rapid, pressured speech with racing thoughts defines flight of ideas. Question 34. A client states, I hear voices telling me I'm worthless. What is the nurse's priority response? A. Ignore the voices. B. Ask what the voices say. C. Tell the client the voices are false. D. Distract immediately. Answer. B. Ask what the voices say. Rationale. Assessing for command hallucinations ensures safety. Question 35. A client with PTSD avoids reminders of trauma. This behavior is called A. Hyperarousal. B. Intrusion. C. Avoidance. D. Dissociation. Answer. C. Avoidance. Rationale. Avoidance reduces exposure to distressing triggers. Question 36. A client taking benzodiazepines long-term is at risk for A. Hypertension. B. Dependence. C. Hyperglycemia. D. Agranulocytosis. Answer. B. Dependence. Rationale. Benzodiazepines have a high risk for physical dependence. Question 37. A client with hyperkalemia should avoid which food? A. Apples. B. Rice. C. Bananas. D. Bread. Answer. C. Bananas. Rationale. Bananas are high in potassium and worsen hyperkalemia. Question 38. A client with panic disorder benefits most from which long-term therapy? A. Antipsychotics. B. Beta blockers only. C. Cognitive behavioral therapy. D. Electroconvulsive therapy. Answer. C. Cognitive behavioral therapy. Rationale. CBT helps identify and reframe panic triggers. Question 39. A nurse notices a client mimicking the nurse's movements. This behavior is called A. Echopraxia. B. Echolalia. C. Catatonia. D. Perseveration. Answer. A. Echopraxia. Rationale. Echopraxia involves imitation of movements. Question 40. A client diagnosed with conversion disorder presents with paralysis but no medical cause. This symptom is A. Intentional. B.
malingering, C. unconscious, D. psychotic. Answer: C. unconscious. Rationale: conversion symptoms are not under voluntary control. Question 41. A nurse refuses medication stating, "You're trying to poison me." Which action is best? A. Argue with the client. B. Hide medication in food. C. Validate feelings without agreeing. D. Force medication. Answer: C. Validate feelings without agreeing. Rationale: acknowledging emotions builds trust without reinforcing delusions. Question 42. A nurse suspects serotonin syndrome. Which symptom supports this? A. Bradycardia. B. Muscle rigidity. C. Hypothermia. D. Hypotension. Answer: B. Muscle rigidity. Rationale: neuromuscular hyperactivity is a hallmark of serotonin syndrome.
Question 43. A client says, "I am a failure because I made one mistake." This reflects which cognitive distortion? A. Catastrophizing. B. Overgeneralization. C. Personalization. D. Minimization. Answer: B. Overgeneralization. Rationale: one event is applied broadly to self-worth. Question 44. A nurse should place which client on suicide precautions first? A. Client crying after divorce. B. Client giving away belongings. C. Client sleeping excessively. D. Client with poor appetite. Answer: B. Client giving away belongings. Rationale: giving away possessions signals suicide preparation. Question 45. A client with substance use disorder denies having a problem. This defense mechanism is A. Suppression. B. Denial. C. Intellectualization. D. Sublimation. Answer: B. Denial. Rationale: denial blocks awareness of the disorder. Question 46. A nurse should use which intervention for a client experiencing dissociation? A. Encourage grounding techniques. B. Leave client alone. C. Confront trauma memories. D. Administer sedatives immediately. Answer: A. Encourage grounding techniques. Rationale: grounding helps reconnect with present reality. Question 47. A client with depression is slow to respond and move. This symptom is known as A. Akathisia. B. Psychomotor retardation. C. Catalepsy. D. Tardive dyskinesia. Answer: B. Psychomotor retardation. Rationale: depression often slows physical and cognitive activity. Question 48. A client is taking disulfiram. Which substance should be avoided? A. Milk. B. Chocolate. C. Alcohol. D. Coffee. Answer: C. Alcohol. Rationale: alcohol causes severe adverse reactions with disulfiram. Question 49. A client with generalized anxiety disorder worries constantly without a specific trigger. This is best described as A. Phobia. B. Panic. C. Free-floating anxiety. D. Obsession. Answer: C. Free-floating anxiety. Rationale: anxiety is persistent and not linked to a single cause. Question 50. A client with schizophrenia is socially withdrawn. Which goal is most appropriate initially? A. Participate in large group therapy. B. Live independently. C. Sit with nurse for 5 minutes. D. Lead a group discussion. Answer: C. Sit with nurse for 5 minutes. Rationale: small, achievable goals build trust and engagement. That wraps up our 50 mental health Nclex questions. If you found certain questions challenging, that's good. That's how you grow exam strength.
Mental health questions on the Nclex are rarely about memorization. They're about safety first, therapeutic response, client-centered care, and choosing the most psychologically appropriate answer. If this session sharpened your thinking, make sure you like the video, subscribe to MCQs Master 101, turn on notifications so you never miss our next 50-question review. Drop a comment below which question challenged you the most. Your consistency determines your success. Keep practicing, keep thinking critically, and I'll see you in the next Nclex review.